That's very important because, you know, if doctors have a lot of knowledge about normal bowel patterns, then they could reassure, mostly mothers, that if a child doesn't defecate every day, it has nothing to do with constipation. And that's the perception of families, because if your child infrequently has hard stool, then immediately they tell, well, we think it's constipation. But we know from studies from all over the world that the defecation frequency in children from the age of 3 years of age is exactly the same as in adults, which means that the children defecate once every 3 weeks to 3 times per day. So it means that if you have every other day a bowel movement, that's fine, and that's not what we call constipation. If you really look at the criteria we use today, then one criterion of constipation is not enough. So you need to have either infrequent bowel together with hard stools, or fecal incontinence together with withholding behavior, but you need 2 symptoms to make the diagnosis of functional constipation. But you will see that if a child defecates only once per week, that he or she has 3 or 4 symptoms of constipation. I think it's more difficult to see all these symptoms in very young infants because, you know, an infant who has hard stools and cries a lot during defecation, that's different from a child who is 3 years old and have the symptoms we see daily of constipation, like fecal incontinence, which is a very important symptom, and it's more difficult to find in infants. But you know, even in infants, they defecate once every 3 days and have hard stools, and then it's easy to fulfill the criteria for constipation. There is, of course, a difference between those children who are not toilet trained and those who are toilet trained. And in the children from the age of 2, constipation is a very easy diagnosis to make. You don't need any lab tests, you don't need anything like X-rays. It's the criteria together with physical examination, and it's easy to make the diagnosis.